The spiritual needs are at the centre of a person's being. This is in relation to what gives them meaning, purpose and connection. And if they're not feeling a sense of meaning, purpose and connectedness, then other interventions won't be successful. They'll have limited success. This is what is at the core of us as human beings, and therefore it's absolutely imperative that any kind of wellness approach takes into account physical, emotional, social and spiritual and even mental, so that it is a holistic care. It's a holistic picture of what gives that person meaning, purpose and connectedness.
And what role can community care organisations and frontline workers who are there out in the field with the clients do in meeting a client's spiritual care needs?
Well, they can do a lot, and often spiritual care is thought of as something that is only the domain of pastors or chaplains or pastoral carers. But in fact, it's like a beach, and that toddlers can play in or whales can swim in. And of course there is a role for professionals and those with technical expertise, but there is an absolutely fundamental role for frontline workers who can pick up and just connect with people on a day-to-day basis and learn how to refer people when they need something more than that, but certainly just to have a connection and a conversation. And so many older people I've spoken to talk about the importance of that person coming to deliver a meal, to clean their house, to do some gardening, and how they have a chat, and that makes life worthwhile because they can connect with somebody.
And what advice or tips do you have for organisations in terms of improving their awareness around practice in this area?
Well, I think it's got to start at the governance level. It's got to start at the top, and it's got to start at a leadership level, and it's got to then go into care plans, it's got to go into operational plans, it's got to go into KPIs. It can't just be a feel-good thing and this is what we'd like to do. What are the measures? What are the systematic things that you can do so that it's embedded? How is it embedded into job descriptions? How it's embedded into recruitment strategies? How is it embedded into reward and recognition systems, into performance systems? It's got to be a systematic approach. It's not good enough just to have it as a nice goal, or it won't happen. It just gets left to the spiritual care workers instead of becoming embedded in everyday practice in every way.